Gauteng Acting MEC for Health, Jacob Mamabolo, has concluded the inspection of health facilities across the province. Mamabolo carried out checks on health and PPE storage facilities across the province and went to see for himself how health workers are managing COVID-19 patients. Gauteng was recently marred by allegations of PPE procurement irregularities that resulted in Health MEC Bandile Masuku being put on special leave. Mamabolo joins us to speak about what he found. A very good morning to you, MEC, and thank you for your time. You've been out and about, jumping in to steer the ship of COVID-19. Just talk to us about some of the findings that came out of your visits, especially as PPEs, the access and the state of PPEs being provided to health workers continues to be a matter that's a pressing one.
Well, firstly, thank you very much and good morning to all the viewers. I must say that it was really a very hectic weekend. Starting on Friday with a visit to the two most important facilities where these are warehouses where we keep PPE, and one is in Centurion Tshwane, one is in Joburg, and then of course health facilities. Just on the PPE matter, I must say that it was quite an important learning curve for me because first, we do have adequate supply of personal protective equipment, both in its chemical liquid form and textile clothing form. So that we have. Some of it is in good condition. Some of it definitely it's very defective or poor quality. And so the challenge there is distribution, logistics, such as transport, frequency of collection, and inside the facilities themselves. In all the 26 facilities I've seen, some of them do not, of course, have got challenges with space for proper keeping, including adequate amount of PPE. There's also the issues of better training, which come with better usage, and making sure that, because if you have got infected PPE that you're wearing, you could be at risk during lunch when you take it off. So there's also the issue of usage. And of course, just the issue of how people conduct themselves, the very same principles of social distancing and all that. So PPE, it's a critical issue. Moving forward, we are going to make sure that there's in-time delivery, that we address quality, and that as and when the health workers or health professionals need PPE, it is right there in time. And of course, one of the issues is the cost. So that we will deal with in respect of PPE. As I've announced, I went to the river in the city of Tshwane, where the PPE was dropped over the bridge into a river, about 1.5 kilometer stretch. It came out in Irene golf course. So we also opened a criminal case, and I must strongly condemn that. But so essentially, the workers' concerns, I can say that they are very legitimate, and we are definitely going to address them, having seen the real problems and what needs to be done.
MEC, as you speak about the social media footage that showed what was disposed in Irene, reports have also emerged that government is buying cigarettes for addicts and rehabilitation centers. While cigarettes continue, tobacco is banned in the country. How much do you know about that?
Well, that matter has come out. We have directed the accounting officer of the department, Professor Lukele, to prepare a response on that matter. And I'm quite confident that he will deal with that matter quite promptly and swiftly, and the people will be clarified about it.
Is government buying cigarettes and providing them to rehab centers during the ban?
And that's precisely the point I'm making, that our accounting officer, who has comprehensively dealt with that matter, will definitely provide a response, including all the questions that you are raising about why, how, when, how much of it, and under what circumstances. The HOD is going to deal with that response quite proactively, and I wouldn't want to preempt his response on any part of that reply.
Okay, as we go back to the state of hospitals and health facilities during this time, one of the issues that was raised by the unions who went to assess how we're assessing the state of health facilities in the country was one that also stood out was PPEs being first, but the staff shortages being a huge barrier when it comes to dealing with the influx of patients that are visiting the health facilities. What are you doing to ensure that the adequate staff are really put into the positions to ease the pressure on the facilities?
Yes, I think one of the most remarkable things that has happened in the health facilities is that, remember, we had not planned for a COVID situation. So managers in the public facilities of the provincial government have worked together to make sure that their staff is repurposed and repositioned to deal with COVID-19. So there are cases where, capacity in terms of human resource has been created. And then secondly, there was a first and second wave of making sure that there are additional human resource capacities, but also it has become clear that there are still challenges, and that matter is receiving attention, and we will be tightening up that issue. So where we are now is that there's good work that has been done to build human resource capacity and make sure that the required resources are there, but there are still areas where I can assure you we are going to resolve that issue.